RSV has seen a spike in cases this year, which is concerning for parents. Channel 8's Matthew Mittleiter has more.
According to the Nebraska Department of Health and Human Services, Nebraska reported 297 positive tests of RSV for the week of October 1st. That's nearly 3 times the amount we had the same week last year. Emergency department visits for the virus are also trending upward, with 192 during this last period, again higher than last year. Shannon Godsill, a general pediatrician in Omaha, said during the height of the pandemic, cases of RSV went down, likely due to masking and social distancing. Now, with COVID restrictions lifted, cases have risen. She says typically older adults with RSV will only develop nasal congestion or a cough, but in small children, the virus can be much more serious.
In kids, especially those under 6 months, what we tend to see are increased work of breathing or quick breathing. We can see decreased appetite, decreased wet diapers, and so it can be really, really worrisome in that age group.
Godsill says if you have a small child, be sure to look out for a decrease in appetite and any struggles with breathing, especially if they're coughing or wheezing.
About 3% of children who end up getting diagnosed with RSV end up getting hospitalized. For our kids that are working lots harder to breathe, sometimes we need to do oxygen. And for kids who aren't eating, sometimes we have to do IV fluids.
The CDC warns that the virus isn't always severe when it first strikes, but can quickly get worse within a few days. There's also a possibility to develop ear infections or even pneumonia.
If you notice that your child was maybe getting better from their RSV bronchiolitis, and now all of a sudden we have new onset fevers or new symptoms that they didn't have previously, you really should see your pediatrician, because this is when we worry about potentially developing an ear infection or a pneumonia.
Godsill also said when it comes to COVID and RSV, it can be difficult to determine which is which based on symptoms. She said it's important to get tested and vaccinated. Reporting in Lincoln, Matthew Mittleiter, Channel 8 News.